Do you feel the $2,000 penalty per employee will go up per year?
You know, right now it's set at $2,000 per employee for those over 30 employees. And some of my employer clients have said to me, well, you know, given all the potential risk of ERISA penalties and fines and whatnot, and the cost of insurance, it would be a cheaper thing for me to just say, okay, I'm out of the insurance business and I'll just pay that penalty. And some have said, tell me why I shouldn't do that. And I said, well, why do you not cancel your health insurance right now? You know, it doesn't cost you anything right now to do away with your insurance program. And most employers recognize that they're using that as a way of recruiting and keeping talent. It contributes to your employee satisfaction. And, you know, that's certainly something that could change as we move into 2014 and we have the insurance exchanges, and depending what your competitors are doing in your market, that might be less of a factor. But it's certainly something that employers are watching, and as things currently stand, we don't have any indication that it's going to be more than 2,000. You know, it could certainly go up because for most employers, at least in the size range that my firm is, it's cheaper to pay the penalty than to buy insurance.
I'll add something to that, and that's a comment that we hear quite a bit, and that would be a true statement if you looked at the penalty itself and you looked at the premium you pay. But as you know, when you think about your benefits, there are tax implications. There are a lot of factors that come into play when you're doing that analysis. So as we get closer and move forward, you know, as Terry mentioned, you have no penalty today and you're still offering employer-sponsored coverage. So that's a very broad and specific discussion, again, to you as an employer, but it's not as simple as looking at the penalty versus the premium that you pay. There are a lot of other aspects that play into that decision that you'll want to navigate through very carefully.
If you want to ask a question using the microphone, hold up your hand and we'll get over to you. But I've got another one written here. We do not include 30-hour per week employees in our plan. When does this become an issue for us, and what are the ramifications?
Simple answer, 2014.
January
That's when it comes into play. It is mandated that your benefit-eligible employees will be those working 30-plus hours a week.
And if you're over 50 employees at that time, you'll be required to do this. Now, if you're still under 50, then
there's no play
penalty.
or pay rule under 50 with there's no penalty.
I asked our office manager, how many employees do we have? And she said 59. And I said, okay, we need to fire 10 people between now and 2014. I'll get you my list.
And so we laugh about that. It's kind of funny, but you know, we've also had questions asked, well, why don't I just start setting up a lot of separate companies? And so I've got this company over here that's got 40-some employees, and this one over here that's 40-some and all that. And again, my understanding is that it's going to be viewed as a whole. The fact that you simply have separate legal entities set up is not going to get you around that requirement.
Kathleen Sebelius has made it very clear that any attempt to restructure your business to avoid compliance with healthcare reform requirements will not be tolerated. So I think that's going to come into play when we look at, you know, employer size, sister companies, common ownership. There are a lot of threads that are going to come into play for consideration. So you have to navigate through very carefully. Remember, this has got to be paid for. And if this ends up being like the Massachusetts plan, whose costs have quadrupled in 4 years, the regulatory agencies will be looking for revenue. So being in compliance is going to be really important going forward.
I think we have a question over here. I'm sorry, Clinton, did you have something?
Go ahead.
I had a question about the tax credit for small employers, and a lot of small employers are just mom and pop shops. There may be 2 people and they may have a son or daughter that works in the family business. Are they eligible to claim the tax credit that's available? And then my add-on to that is, do state and federal tax credits add together, or are they exclusive of each other?
Good questions. Yeah, for small mom and pop shops where you know, the only people who work there are also the owners or family members of the owners. They're not eligible for the tax credit, not the federal credit. And the reason why is in that calculation you have about 4 or 5 different numbers that come in. One is number of employees, which is based on hours, not 30 hours, but it's where you take the hours and you add them together and you divide by 2080. But you exclude owners and their family members from that. And then when you look at the wages and you're calculating average wages, again, you take the owners and you exclude them from that and their family members. So what they're trying to get down to is what we'll call kind of the unrelated parties that the company is paying on their behalf. You also exclude seasonal employees, which seasonal employees are defined there as employees that work less than 120 days a year. So that's another group that you exclude from that category. In terms of the federal and the state credits, they don't necessarily interact in the sense that you have a federal credit that's calculated without regard to the state, and you can take it. Then you have a state credit that's calculated without regard to the federal, and you can take it on your state tax return. What does happen, though, is like with many tax credits, if you take a credit for something, you then don't get to take the tax deduction for the expense. So we see this a lot in research and development credits also, where a company might spend, you know, $100,000 on R&D, qualified R&D, or now health insurance for their employees. And so they're not going to be able to deduct the $100,000 to calculate the tax. Instead, what they're going to do is they're going to calculate the tax and then take a credit against it. But for state purposes, now you probably have a modification that you should be allowed to deduct, in my example, the $100,000 for state tax purposes. I haven't seen anything that says that, but that's the way the other credits work. So it's a couple good questions. But so I did want to come back to Massachusetts, and so probably a lot of people know about that, but we have had a somewhat similar system, or Massachusetts has had a somewhat similar system to this national version. And can you kind of give a 2 or 3 or 4 minute kind of high level, here's what's happened in Massachusetts, it's worked well, it's not worked well, it's totally unprepared too, so I'm putting you on the spot, I know.
Well, I'll make it a 30-second
there you go.
comment. I think that it did accomplish covering the majority of the state's population in Massachusetts. I mean, there's a very small percentage that still remain without insurance. However, I think on the negative side of the equation is the financial aspect, in that this is a very difficult concept to wrap your arms around when you're talking about healthcare financing, because there are so many different entities that are involved in the process. Even if you take the employer-sponsored equation out of it, when you think just in the medical industry itself, in terms of receiving health care, how many different components there are. And I think it's a very difficult task to accurately, we have the Medicare example Clinton mentioned earlier, to really accurately gauge cost. It's a very, very difficult task. And I think that's where Massachusetts, in some opinions, has failed, because the cost aspect is 4 times greater than what they originally expected it to be at this benchmark in time, which is basically 4 years after enactment. So, you know, I think there was a good benchmark for regulators to look at. Did that play into the equation of cost calculation they went through? Is this going to be more accurate? The unfortunate answer to that is only time will tell. So that would be my comment to that.